Hi everyone, welcome back to my YouTube channel Running Pharma by Priya. Today, as I have started GPAT series and I am posting mini question bank on various subjects. So today we are going to study the question bank on pharmaceutical inorganic chemistry. So without taking much time, let's start with the question bank. Now here you can see the first slide, that is I have put the title Pharmaceutical Inorganic Chemistry MCQs, which is important for GPAT as well as pharmacist, right? So the first MCQ, which one of the following, let's start with the first MCQ, which one of the following is an example of an acidic buffer, right? So they can ask you the example of acidic buffer, basic buffers, okay? So you have to study this very well. So there are four options: ammonium hydroxide plus ammonium chloride. They can ask you the combination, so you have to do the in combination format, ammonium hydroxide and ammonium nitrate. The fourth option is formic acid and sodium formate. So the correct option is the D, that is formic acid and sodium formate. So you have to go for this. Second question, what is the shelf life of alkaline buffers? So there are four options: 2 years, 1 year, 3 to 6 months, 1 to 2 months. So maybe you have thought, so the correct answer is right, that is D again, 1 to 2 months is the correct shelf life for alkaline buffer. Again, if you want to use, you have to prepare it freshly and then you can use further. Then question number 3, if the blood is mixed with the 0.2% of sodium chloride solution or with still water, enter the blood cells and it swells the condition, dash dash is known as. So you have to study that. If the swells the condition, then what is the, there are options: isotonic, hypotonic, hypertonic, isoosmotic. So the correct option is hypotonic, that is B. Question number 4, if the sodium chloride is added to the solution of drug to lower the freezing point, okay, to lower the freezing point of the solution and make it isotonic, so it comes under which method? So there are four options: class 2, class 1, class 3, class 4. So the correct option is class 2 method. Class 2 is the correct method. Question number 5, hyponatremia is the condition in which hyponatremia, hyponatremia, you have to know that. So there are four options: low level of potassium, low level of sodium, high level of sodium level, high level of potassium, okay? So don't be confused in sodium and potassium. You have to study both the parameters and both the terms nicely. So hyponatremia, the correct answer is correct, the B, that is the low level of sodium. If inside our body the sodium level is low, then that condition is known as hyponatremia. So let me take the eraser again. Okay, so let's go to the next question now. Lack of bicarbonate, here I have to take the pen. And the sixth question, that is lack of bicarbonate causes lowering of pH. So what that condition is called as? Lack of the bicarbonate. Bicarbonate means HCO3 minus, that is the bicarbonate ions. So if the bicarbonate ions causing the pH, lowering the pH of our body, so what happens? What is the condition? Metabolic acidosis, metabolic alkalosis, respiratory acidosis, or respiratory alkalosis, correct? So these all four terms you have to read it nicely because these are little confusing. So this condition is known as metabolic acidosis. For metabolic acidosis, it can be used. What happens in hyperkalemia? So like two questions before we have studied hyponatremia. Now the question is what happens in hyperkalemia? Hyperkalemia, there are four options: low level of potassium, low level of sodium, high level of sodium, high level of potassium. So hyperkalemia. So here I will give you one trick: kalemia, that is KK, you can remember. So the correct answer is exactly, you have guessed it correctly. High level of potassium means hyperkalemia. Hyper means, you know, hyper means more, and kalemia, so I am giving you trick. Kalemia K, that is K plus is more, so that is known as hyperkalemia. Okay, you can remember in that way. So yeah, that will useful for in exam. The next question. What is the concentration of compound of sodium chloride injection? Here I guess answer you can see here, that is 1.6%. Weight by volume is the correct concentration for the sodium chloride injection. So there are many type of injection, that's why I have put the question here. Mostly they will ask you on the sodium chloride injection because it's very important. So concentration is 1.6% weight by volume. Then what is the starting material for the preparation of calcium gluconate? So there are 4 options. Glucaric acid, gluconic acid, sulfuric acid and glycol. So correct answer is gluconic acid. Assay of calcium gluconate. Maybe you are thinking why the important question. Calcium gluconate is very important. That's why assay, they can ask you assay, they can ask you the method of synthesis, like which is the important constituent or starting material. So assay of calcium gluconate is based upon the complexometric titrations. What is the pH of urine? So basically they can ask you urine pH, blood pH or skin pH, anything. So that basic thing you have to study well. So the pH of urine is, correct answer is C, 4.5 to 8 is the correct answer. That is the pH of urine. That means it comes under the slightly alkaline conditions. Acidic but slightly alkaline. Sorry. Limestone is the synonym of. They can confuse you with this like question. Limestone is the synonym of sodium chloride. You know it is the wrong answer. Sodium phosphate, maybe possibility is there. Okay, so the correct answer is calcium carbonate. That is the B. B is the correct answer. Calcium carbonate, also known as the limestone. Then what is the percentage of zinc acetate in powder form of zinc oxide eugenol cement? So you know that question comes from the dental products. You have a chapter in the pharmaceutical inorganic chemistry, and zinc eugenol cement is very important. So you should know what is the percent of zinc acetate here. So the 1 is the correct answer. That is the percentage. 1% is the correct here. 6.9 actually. 1% zinc acetate in powder form of zinc oxide eugenol, that is 1%. Then what is the role of olive oil in the zinc eugenol cement? Again the role of oil is there. So what is the main role of olive oil in zinc eugenol cement? So there are 4 options: anesthetic, plasticizer, as accelerator, or none of these. So correct answer is B, right? Act as a plasticizer, okay, not anesthetic. What is the factor of ammonium chloride assay? This is very important assay in pharmaceutical inorganic chemistry. So please do it, like read it carefully, complete assay. So there are 4 options. So there are like 000 digits are there. You can read 0.005345, 0.05349, 0.004539, 0.02345. So the correct option is yes, that is 5349. Okay, here they will confuse with this 4539, but you have to remember that is the 5349. You can remember in that way, 5349. That will be the easiest way. Next question: which one of the following is an example of systemic antacid? So systemic and non-systemic antacid, very important question from gastrointestinal agents. That is the like 3rd or 4th chapter of PIC, pharmaceutical inorganic chemistry. So for options are aluminum hydroxide, sodium bicarbonate, magnesium phosphate. So you have to choose one, right? So the correct answer is sodium bicarbonate. Okay, this is very correct and this is very important as per my logic. Very VIMP question. So please do it. Sodium bicarbonate is the correct answer. Acidosis results in increasing level of what ion? Acidosis. Okay. So maybe we will think acidosis, sodium chloride or phosphorus, but no, the correct answer is hydrogen. Hydrogen, if hydrogen ions are increased in our body, so that condition is known as acidosis. Okay. Normal, then next 18 number question. Normal arterial blood pH is 8, 6.8, 7.4, 6.4. So you know that is, that is the correct answer is C, that is 7.4. Yes, so correct answer is 7.4. Next, that is parathyroid hormone enhance the release of calcium from bone, is released when adolescent levels climb, activates osteoblast, targets the thyroid gland. So most of the time we will think parathyroid hormone, it is related to thyroid or something kind of thing. So it will target the thyroid gland, but no, the correct answer is first. It will enhance release of calcium from bone. So it will enhance the release of calcium from our bone. So that's why this hormone, when this hormone release, it will enhance the calcium. Question number 20, dash dash compound used as a desensitizing agent. Again, the question came from the dental product only. So there are 4 options, gel, potassium acetate, zinc chloride, magnesium, correct. So the correct option is zinc. Zinc is very important in dental products, so zinc chloride. The largest percentage of body water is located in what compartment? Yes, the correct answer is intracellular fluid, not ECF, that is ICF, intracellular fluid, B, not ECF, okay, yeah. Which condition would cause a drop in pH? Yeah, this is very important question. Which condition cause drop in pH? So what is what that condition is known as? So this condition known as hyperventilation, hyponatremia, hypokalemia, hypoventilation. So the correct answer is hypoventilation. If like the condition causes pH drop in our body, that is hypoventilation. Sodium fluoride is acid by which method? NaF. This is very important. So sodium fluoride is acid by which method? Oxidation, reduction, complex symmetry, precipitation, acid base. The correct answer is precipitation. Sorry. Then magnesium sulfate is used as a catharatics. Okay, yeah, MgSO4. Then the last question, dash it helps in preventing dental caries. Here I have already highlighted it as the fluoride. Fluoride, okay, doctor says every time use the fluoride containing toothpaste for your teeth because it will prevent the dental caries, but fluoride content should be very less, okay, not excess. If excess fluoride will be there, then it will be leads to death also, okay. Only the very limitation point something percentage fluoride can be okay for our body. So fluoride is the correct answer. So yeah, that's all. So best wishes for your exams. Prepare well for exams, and if you have any query, doubt, please feel free to put in comment section, and please like my channel and subscribe to my channel. If you like my video, share with your friends. Thank you very much, and all the very best for your exam.